Teton County Hospital almost closed their doors this year. Part of the problem is that insurance companies aren't paying the bills. We have insurance companies here for Bingham Memorial that have taken up to 18 months to pay a major claim, and they're allowed to do it under our law. So together with Bingham Memorial, I drafted legislation to fix that. And here's one of the biggest problems with Medicaid reimbursements, with our rural hospitals, with regulations, and all these types of things, is that this bill is good legislation. It would have solved a real problem. The insurance companies were on board with it, the hospitals were excited about it, and the Idaho Freedom Foundation blocked it. It was a negative score because it was going to create new government regulations, and I couldn't get a hearing in the business committee because of that. That's the reality of the Idaho political world that we have right now. When you adhere to an ideology that is driven more by getting money from out-of-state donors so that you can help get people elected, and less from solving real problems, you don't get to solve real problems. That's a real problem. So I want Idaho problems being solved by people who are from Idaho and in Idaho and care about Idaho. We need to increase the Medicaid reimbursement rates. We need to fix our budget so that we can find this money and find the value there. We need to keep Medicaid expansion going. We can't just send people to the exchange. It's not legal. Medicaid expansion is there for a reason, and it helps. We no longer have the backstops we had before. These are some of the things that we can be doing.
All right. Well, there's a lot to unpack there, but let's start first with the assumption that this is a good bill. I think that probably every legislator thinks the bills they draft are good bills, or they wouldn't put the time into it. So that's a pretty normal assumption to make. The problem in the legislature is that you don't have to just fix the bill to satisfy yourself. You have to convince a majority of 105 other legislators that your bill is a good bill. And I texted the chairman of the business committee where this bill was submitted and where it did not get a hearing. And I said, Ben is claiming this as proof that IFF rules Boise and is the reason we can't get good things done and problems solved in Boise. The chairman's response was this: no IFF score impact on receiving a hearing. I don't look at IFF scores. 829 would have caused much more fraud, waste, and abuse in our medical system. Happy to jump on a call and discuss further, but it was a very poorly crafted bill. I'm pretty sure the hospitals gave those to the idea. And then he gave his permission for me to share his comment. So it probably was a bill that would be helpful to the hospital. It doesn't mean that the bill is completely without merit, but the idea that the bill didn't get a hearing because of the Idaho Freedom Foundation is completely without merit. And as someone who has passed a lot of legislation through the legislature, I can tell you that if I have a bill in a committee and it's not getting a hearing, it's my responsibility to sit down with the chairman and find out what their concerns are. If that had happened, it sounds like the message that would have been communicated is that there was a concern about fraud, waste, and abuse that needed to be addressed. And instead of addressing that concern, we've just chalked it up to IFF and then attacked people's motives, assuming that they have some ulterior motives, and also assuming that out-of-state people somehow control the chairman and that out-of-state people automatically have ulterior motives as well. There's just all of these leaps of logic that don't really make any sense. So we really need to get back to just talking instead of making broad accusations about groups and motives. We just need to be talking about what worked in the bill, what didn't work in the bill, and then fix that. I did speak with the chairman on the phone, and he assured me that the Idaho Freedom Foundation score is just absolutely something he doesn't even ever look at. But he also clarified that about 20% of the payments that we make through Medicaid are flagged with some kind of a problem. It doesn't mean that they all are fraud, waste, or abuse, but it does mean that about 20% of them require some extra verification in order to feel comfortable paying them, and that takes time. And so speeding up those payments was a concern. Hopefully that helps.
I think it's sad that somebody would want power that much that they're willing to spread rumors and gossip in our community. There's nothing more poisonous to a community than rumors and gossip. They set in like gangrene and eat away at the sense of decency. That's a quote from a Haitian author named Wis August. I learned today from a friend that door knockers are saying that I have legislation drafted that would make abortion legal for up to 9 months. Nothing could be further from the truth. I am pro-life. I've always been pro-life. I will always be pro-life. My stance on abortion aligns with the same stance of my faith, and that has never wavered. When people are knocking on doors and spreading rumors and gossip, it has to make you wonder why. When my same friend called my opponent and said, "Did you know this is happening? And you need to put a stop to it because these people represent you. They're spreading your message. Is that what you want your message to be?" She told him, "Well, I can't control what they say. It's too late in the election to do anything about it anyway." I did go to Boise and meet with some doctors. And yes, some of those doctors did donate to my campaign. I'm on the Health and Welfare Committee. I meet with doctors every day. That's my job. For me to meet with doctors in Boise and for some of them to donate to my campaign because they support who I am and my common sense approach to legislating, that's not nefarious. We did not discuss abortion in that meeting at all. We discussed rural health care. We discussed legislation. We didn't talk about abortion. If we want to create rumors and we want to create gossip and we want to drag somebody's character through the mud, I want you to think very closely about who you want representing you. Somebody that's willing to do that, or somebody who just wants to solve problems and make our communities better.
So what I hear in this little post is snap judgment of a situation that my opponent cannot have firsthand knowledge of. I was actually able to find the door knocker that spoke to the person, that spoke to the person, that spoke to Ben. And that sweet little door knocker did not talk about legislation that Ben wrote at all. The door knocker was talking about the abortion ballot initiative and why it's important for people to be informed and vote against that. And then they also talked about their support for me, but they did not talk about my opponent at all. And yet, in the game of telephone tag, by the time it got to the end, rather than going back to find out if that's really what happened, what we have here is a public attack that's condemning other people's character and attacking their motives based on false information. And that's a problem. Beyond that, we have this question of abortion, generally speaking. So as the vice chair of state affairs, I was in the middle of a lot of the discussions around abortion. I worked to address the concerns of the doctors about liability under the abortion statute. And I've heard all of the angles on the arguments around the exceptions that people are interested in. So this is not a black and white issue. And one of the greatest risks to us in Idaho in terms of life is that our strong pro-life statute will be weakened and whittled away until it will no longer be effective at protecting innocent babies. So I think there's a couple of things here. I think for me, it is a huge red flag. We're not talking about a doctor in Boise that gave a donation. But I think it's a huge red flag when you choose to attend a fundraiser sponsored by a group of doctors who are formally organized, and their organization exists because Roe versus Wade was overturned, and they want to restore abortion to OB care. So when you make a decision to attend a fundraiser with a group like that, it's a totally different thing from just I happen to talk to a doctor about something else. And I think that's being sidestepped here. The other thing that I would like to say is that my response to the friend who shared that response with Ben. So again, my opponent, I'll follow proper decorum here, is removed a couple of times and severely misrepresented. What I actually said in that phone call was, first I described what my door knockers were expected to do, which is talk about the initiative. And then I said, at this point in time, the information is multiple times removed, and I would not have a way of knowing exactly what really happened in the first place. But I will definitely be sure to be clear in my communication with the people that I know are helping me, so that we do not have this kind of misunderstanding again. And then I did my homework and I tried to find out where the person was that heard the original conversation and the person that knocked the door. I did find them. But one thing that I thought was a little disappointing is that the person who complained to the person that complained to Ben knew the person that knocked the door in the first place. And I think really the whole situation could have been easily avoided if the person who was concerned had just talked to their neighbor and made sure that she understood what was being said, or at least expressed directly to her what her concerns were. Instead, we have this game of telephone tag and then a public attack, which is unfortunate.